Hi, this is Connie Haxby, licensed clinical social worker, and today I wanted to talk about HIPAA and confidentiality, as well as something called mandatory reporting. So confidentiality with therapy is really important because we want to make sure that our clients feel comfortable sharing with us information, knowing that we're not going to share that information with anyone else. This includes supervisors that we may have, co-workers that we may work with, anybody that we could possibly relay information to. You need to know that we're not going to do that. We can't disclose any information that gives away any details about who you are as a patient, beyond maybe, your gender. So, let's say I need to speak to my supervisor. I want to get some feedback on a patient. Maybe I need to know a little bit of direction about where to go. I'm not going to disclose any information that's going to give any hints about who you are as a patient. So you need to know that that is something that your therapist cannot disclose to anyone. This includes if you had a primary care physician and let's say they wanted to coordinate care with me and they were to call me and say, hey, I've got this patient, I want to talk about putting them on medication, but I know that they've been seeing you and I just wanted to get your feedback. I can't even confirm or deny that you're a patient to that person without your written consent. That's called a release of information. So just make sure that if there's anybody that you want your therapist to relay information to, whether it's a family member or a friend or another professional, that you make sure that you sign a release of information for that person. Now, a couple of things that we have to look at when it comes to, HIPAA and confidentiality, there are a couple of things that us therapists have to do to make sure that you and others around you are safe. And that's where mandatory reporting comes in. So what it means to be a mandatory reporter is that we are professionals who, if we hear information from a client that gives us the impression that the client is either a danger to themselves or a danger to someone else, we have to make sure that we're keeping all parties safe. So if you were to disclose to me that there was somebody at work that you were really angry at and you wanted to go to this person's house and harm them in any way, what we would have to do a duty to warn. And what that means is that we would have to contact the police with all of the information that we have about this person and your information and say, hey, this person disclosed to me that they are going to harm this person, and so I needed to report that to you. Another thing is if you were to call me between sessions and say, hey, I'm feeling really low and I'm going to harm myself, I'm going to kill myself, I'm feeling suicidal, and you were not willing to go to the hospital yourself, then I would have to call the police or the ambulance and have them sent over to your home just to make sure that you're safe, because I am a mandatory reporter. Another information piece of that is if you were to come in and say, hey, my brother-in-law is abusing his children, I would have to turn that into CPS. If you were to come in and say, hey, my neighbor is elderly and they are being taken advantage of by their son, I see their son coming in and they're always taking, money out and taking advantage of their elderly parent, then I would have to turn that into APS, Adult Protection Services. So just know that there are certain situations that we do have to report information that would keep all parties safe. Beyond that, we are not allowed to disclose any information. So, sometimes I'll have patients come in and they'll share information with me, and before they do, they'll go, I don't know if I can share this information with you, because they're afraid that they're going to get in trouble or that I'm going to tell somebody. 9 times out of 10, that's not the case. Even if it's illegal activity or if it's something that's, kind of unethical, I can't share any of that information with anybody unless it's something that's going to harm the patient or someone else. So just keep that in mind. One more thing that I want to point out is that this also goes for adolescent patients. So if I have a teen patient who comes in, I make sure that I sit down with mom, dad, guardian, whoever, and the patient, and I spell it out for everyone saying, hey, I can't disclose any information to you, mom and dad, about what this patient says to me in here. Now, if we need to get together every once in a while to go over, treatment planning and how the kiddo is doing and what steps we need to take, and I have that child's permission to bring up some information, then absolutely, that's something that I would want to bring to someone's attention. Again, unless this child is telling me that they are going to harm themselves, I cannot disclose that information to anyone. Unfortunately, that also goes with, maybe some poor decisions on that teen's, behavior. Maybe there's some risky sexual behavior going on. Maybe there is some illicit drug use going on. I have to keep that person's confidentiality because I want to make sure that that person trusts me to share those things with me, and hopefully we can get to a place where that person makes better decisions. So just wanted to make sure that everyone knew what confidentiality meant and everything that it entailed, and also about the mandatory reporting, because that's really important to know coming into session, that there are some things that we have to disclose, again, just to keep every party safe. Hopefully that helps it clear up any misunderstanding or any questions that you had about confidentiality, HIPAA. And until next week, have a great day.